What is COVID-19? COVID-19 is a highly contagious infectious disease caused by a type of coronavirus called SARS-CoV-2. In Canada, there are over 114,000 people who have or had the disease, and more than one-third of those cases are in Ontario, with more than half in Quebec. Cases, fortunately, in the general population are going down here. However, cases among farm workers are still going up, and that has raised our concerns. Why should you be concerned about COVID-19? 80% of people experience mild flu-like symptoms when they have the disease. However, COVID-19 is much more deadly than the flu. 15 to 20% of people infected need to be hospitalized, and several of those in intensive care. It can cause serious health problems, including severe difficulty breathing, chest pain, loss of speech or movement, and becomes worse with pre-existing conditions like asthma or diabetes, or with increasing age. However, recently, younger adults have also been experiencing severe consequences. Asymptomatic people is something we hear an awful lot about. Some people can test positive for COVID-19, meaning they have the virus but don't experience any symptoms or feel sick. These are referred to as asymptomatic people. Many people may start out as asymptomatic, but a large number go on to develop symptoms. Asymptomatic people can still affect and infect others. It is very important to follow all the COVID-19 safety precautions outlined here and by your employer, regardless if you feel healthy. In this slide, we see how contagious COVID-19 is and how quickly it can spread. If there are no precautions in place, such as physical or social distancing, the number of people infected would be very, very large. And as can be seen here, one person can be responsible for infecting over 400 people in a month. How is the SARS-CoV-2 virus spread? The source of the disease is an infected person, as we can see in this slide. And they cough and sneeze and create droplets of various sizes. And some of those droplets spread through the air and can be inhaled by other people. And some of them fall to surfaces. And then by touching those surfaces, they enter the body if you then put your hand to your mouth or rub your eye or something like that. It is also the case that the virus can spread through fecal matter flushed into the toilet and becoming airborne through that flushing, and then become inhaled or on the surfaces in a bathroom and get transferred to people that way as well. So the most important things to remember are that inhaling droplets and small particles released in the air when an infected person coughs, sneezes, talks, sings, shouts, or breathes is one of the main risk factors. And as well, the smaller particles can hang in the air for hours, so that the risk, particularly the inhalation risk, grows with time and with the level of enclosure of a space. We also need to be concerned about droplets falling to the surface where the virus can remain alive, including floors, counters, and tools for several hours or even days, especially on plastic. And this is a particularly concern with respect to touching those surfaces and then touching your eyes, nose, or mouth, which is really important to avoid doing where possible. Surfaces and air in the washrooms can also be contaminated because the virus can be found in and around toilets as a result of the feces, as we mentioned earlier. So we need to pay particular attention to those environments. Let's just review what the signs and symptoms of COVID-19 look like. Unfortunately, COVID-19 symptoms are similar to other illnesses, including heat stress, a cold, or flu, and so can be confused with those other more common diseases. More commonly reported symptoms in adults include fever or chills, a dry cough, tiredness or weakness, a new loss of taste or smell, aches and pains, sore throat, GI symptoms like diarrhea, abdominal pain and vomiting, headache, conjunctivitis, which is otherwise known as pink eye, and as mentioned previously, serious symptoms like difficulty breathing, shortness of breath, chest pain or pressure, and loss of speech or movement. There have already been more than 1,000 temporary agricultural workers who have been diagnosed with COVID-19 in Ontario in at least 15 outbreaks, and 3 workers have sadly died, including Bonifacio Eugenio Romero, whose photo we include here, who was the first to pass away in early June. The main areas affected are Windsor, Chatham, Kent, St. Thomas, Haldimand, Norfolk, and Niagara. Individual workers have also tested positive, but at the same time, on lots of farms with strong safety practices, no workers have developed COVID-19, which tells us that prevention is possible. Migrant farm workers have greater risk of exposure to SARS-CoV-2 for a variety of reasons. Some of the reasons are that equipment places workers close to each other when they're working in fields or in other places. Example, when planting, and also tasks can place workers together. That's another example, like packing fruit or vegetables. Workers often share tools, and also they work far away from running water, so soap and water is difficult for hygiene. They live in shared housing, which can be cramped in the sleeping quarters, in the washroom, and in the kitchen. They often are move around through group transportation, like little buses or vans and cars, which is an enclosed environment. They also need to visit town and encounter people there, and also interact in other environments to get supplies and services. And they mix with many people on the farm and off the farm, which elevates the risk. Migrant farm workers also have a greater risk of infection with COVID-19 because the disease is spread from person to person or person to environment to person. So the more that people are together in enclosed areas, the higher the risk. Plus, the illness is often hidden because it can be so very mild or still developing, and people are asymptomatic. Workers have now been prioritized for testing, but there's still some uncertainty about that and some delay in getting the results back. So we're not aware of who is infected and who isn't. And it is also true that workers may not report mild cases because they fear or of uncertainty about the loss of wages or the potential for reprisal or even being sent home. And some bosses may not take mild symptom reports seriously either, since it looks so much like a cold or allergies.
This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OCHO.